So co-production to me, on an individual level, means being heard and being involved in, as a carer, being involved in decisions about me, with me, and with the person that you're caring for.
Co-production to me, and at number five, really means the meaningful and impactful engagement and participation of service users like myself, or people with lived experience who haven't been able to use services, having the opportunity to equitably work alongside the professionals and those with learned experience who are with and around them.
Real partnership, true empowerment, clarifying right up front, is this co-production or is this a consultation engagement? And what is going to be the final outcome that you're looking to achieve?
On a work level, co-production means to me feeling equal to the people that I'm working with, no matter at what level they're working at. Being able to walk into a room and not identify who's the senior person and who's the person with lived experience. Having support in place so people can be involved. So there's something about when people can't communicate. So for example, I looked after my mum, she had no communication. I've worked with people in different ICSs and they use a communication board, and bringing those people into conversations, because people tend to steer away when there's more support needed to involve people in shaping services. People steer away from it because there's more time and it takes more time and there's more effort that has to go in place to include people. But I think by including those people, that is true co-production.
Co-production in a general sense refers to a process where many organisations work together to create or produce something.
To me, co-production means being able to have a voice on things that matter to me, such as health and social care. For me, it's a tool of a mechanism that supports people to really have a voice. And there's an old proverb that says, those that have lived it feel it. So as someone with severe and enduring mental health challenges and having access lots of health and care support, I was astonished, and have always been, how many decisions were made about me without including me in those decisions.
Co-productions are coming together of minds, of lots of different people involved in one particular project or aspect, and just working together to get the best outcomes for people that the service they're designing is for, so that everybody has a say and is on an equal footing to get the best possible out of those conversations and discussions.
For me, it's about building understanding about what would help make a difference to services, being involved in the decisions about what, how and who of services, and being given the opportunity to develop the skills to being part of delivering those services as well.
So co-production means a lot to me personally, because I think it enables people to have a voice on things that matter to them, but ultimately get the right support for them, their families, for their communities. Co-production is about coming together for a shared experience. It's about bringing our collective knowledge and skills about a particular topic and working to come up with the best possible solution that works for individuals.
Co-production to me means, I guess, people who come from different perspectives working together to do something. And in mental health, that is often people who provide services, people who use those services, people who care for people who use those services, and other stakeholders around them, other organisations that might be interested in something, but everyone coming together to produce something. And it's the production that's the important bit, I think. That there's something that comes out of it at the end.